Thank you so much, Matt, for putting me on stage, agreeing with just 3 people who are using the Caprini score for what we just saw. But it's also a great opportunity to share this presentation, of course, with Pauline Martin-Beau and with Caprini himself, who is my hero. But first of all, let's brainstorm on the real need of really calculating the thrombotic risk in our patients. If we really look at the literature, we see that there are papers telling us that there is no risk, so it's very safe to do these procedures. But we also have papers showing us that the risk can go up to 16% of the procedure. So clearly this is something that concerns us not just for some days, but up to some weeks, according to the publications, and up to 10 times the normal risk of thrombosis. And if we look at the most recent literature focusing just on the endovenous, we see that the range is really in between 0.1 and 0.3 for PE and DVT, but also all the way up to 6%. And at the same time, we are not considering the issue of the non-thermal, non-tumescent techniques. So we have other papers telling us up to 13% of cases. So clearly, this is a hot topic. If we look at Tom Wakefield's studies, we see that in reality, what really is a predictor for potential thrombosis is also the type of procedures. So it is really a difficult topic because we cannot put all the different procedures together. We should really analyze the different scenarios. So when we are looking at the core trends around the world, we see that in Ireland, for example, the 73% of our colleagues are always giving some thromboprophylaxis, but that in 71% of cases is just one shot of heparin. So I think that at least on this we can agree with Isaac and on the other ones, and this is a nice contribution of Isaac himself, that we need to assess this issue properly. If we're talking now about Caprini, we see that in the same publication of Wakefield, a Caprini higher than 8 was not a predictor for this kind of issue. But bear in mind the biases I mentioned before, because indeed you have papers like this one showing us that the Caprini is not able to really give us the thrombotic risk in unselected consecutive hospitalizations. Yet if we have a proper thromboprophylaxis, we significantly decrease the risk. So again, we have to be thinking surgeons. When we are talking about Caprini, we are not talking just about 5 as a score or 8. We have to customize based on the specific scenario. We are talking about a score that has been validated in more than 4 million patients. And in this case, we did a specific publications looking at the specific population of vascular surgery, where you can see we should stay more on the 11 as a score rather than the 8 that was used before. That's why we created this app. There is also a conflict of interest, I would say, even if it is for free, that you can use before even meeting the patient so that you have already the score, so that you can solve issues is like the one that the same Lobastov reported, where you can see that indeed with a higher than 11-point score, you are having a significantly increased risk of thrombosis. Not to mention, again, the fact that we have to consider maybe a different chapter for the non-thermal, non-tumescent, like in this paper where the only risk factor for glue was actually a smaller than 5 millimeter caliber. And I would like to debate on why they were actually treating smaller than 5. That's why in the end I don't think there is a solution yet. We have to discuss about this. We have to have a real-world scenario in our evidence, and that's why I invite you to register to the V-Registry. That is a tool we put out for real-world data, where we can look also at these different aspects of the different procedures and of the different scenarios. Just imagine if the patient is going, for example, to the pool as a habit, the patient is actually wearing 4 pairs of stockings, because in the water you have the equivalent of 80 millimeter mercury. So these kind of confounding factors are really biasing the literature we are discussing today. Not to mention the ethnicity. We all know, for example, the Asian population compared to the Caucasian population in the thrombotic risk. So in conclusion, I will quote my hero, that is indeed Caprini is saying that there are many roads to Rome. So Caprini is not the only solution, but it's at least a chance to be thinking surgeons, as we must be in front of this scenario. Rome is indeed our next destination, so I'd like to invite you to our next global event that will be done with the institutions, touching the topic of the recommendations also of the proper prophylaxis. And of course, as a representative of the UAP, I look forward for being all together at the World Congress next year in Buenos Aires, once again honoring our Queen, Pauline. Thank you so much.